order. I do declare a quorum at this time. I understand we have a few of the board members participating remotely. You can chime in and state your name. Can they hear us?
Yes.
Okay. Anybody online? Oh, she says she can't really hear me. So that's her. Oh, that's yours. Okay. I just yelled in your ear. We've got a remote one somewhere. You know, ever since we got fancy, all these little hang down mics. All right. Okay, we understand we have a few members on the phone. If you could please state your name.
Hey, Alvin, it's Melissa King.
Okay, we gotta cut them up somehow. Now, Melissa, can you try and repeat?
I can. How are you?
All right, we can hear you loud and clear now.
Perfect.
Any other board members on the phone?
Hey, Alvin, if they are on the phone, like I see Laura on there, she's going to have to not just unmute her phone, but hit *6 for the first time and then mute her phone back in order for you to hear her.
I'm on Zoom on my computer. This is Laura.
Okay, cool. So we have Melissa King, Laura Moore participating remotely. We have a quorum together. Ms. Jackson, would you mind opening this up?
Good morning, everyone. If you will, please bow your heads. Most gracious Father, thank you for this beautiful day. Thank you for this wonderful group of people that are sitting before us and those that are out on Zoom. Most gracious Father, help us make all the decisions that you set forth in our hearts to do the right thing. If you will, just protect those that are dealing with COVID right now or other illnesses that are life-threatening. And all I can ask, Father, that in everyone's heart that is sitting here, they have someone that they do love and that are suffering of something. So if you will, please take your arms and protect them as well. In Jesus' name, I do pray, amen.
All right. Approve the agenda. Have a motion. We approve the agenda. Motion TJ, second. Second, Ms. Nancy Northshaw. All in favor? Motion carries. Open forum. Any members of the public care to make a comment? Give a moment in case there's anybody on Zoom.
Chair, while we're waiting for the public comment, this is your opportunity. If you have emailed me or called me and you have a report to submit, I do know that Eliza Pillars wanted to submit a report this morning. I think their president, Yolanda Murray, and Dr. Aldwin Fletcher are on the call. So this is your opportunity at this time to present your report.
Good morning. Greetings from Eliza Pillars Registered Nurses of Mississippi. I am Yolanda Murray, registered nurse, family nurse practitioner with over 27 years of nursing experience. I am the 18th state president of Eliza Pillars Registered Nurses of Mississippi. I was sworn in virtually on May 1st, 2021 to serve in this capacity. I am an active member of Mississippi Nurse Association and a proud member of Alpha Kappa Alpha Sorority Incorporated. I was born and raised in a small town in the Mississippi Delta named Beulah. I currently live in Hernando, Mississippi. Eliza Pillars was founded by Eliza Pillars in 1945 and remains the first African-American nursing organization. We are currently serving the state of Mississippi in districts. We have 5 active districts. District 1, Tupelo. District 2, Greenville. District 4, Jackson. District 5, Meridian. And District 6, Natchez. We currently have 2 inactive districts, hoping to activate those during this tenure. Our mission and values are guided by Ms. Pillar's own inspiration. Our motto, an organization dedicated to excellence in healthcare. Our mission and values remain constant, even throughout these last 2 years of our global pandemic of COVID-19. How do we continue to carry out this mission? By service. Community services are reflective of Ms. Pillar's life. Giving back to the community through health and education services are very important to the membership. Pearl Project, prevention, education, advocacy, referral, living healthy. In the midst of the pandemic, we are still able to fulfill this mission by providing community vaccine drives, educating the public about vaccines, masking up, social distancing, and kudos to all the nurses that are on the front line and behind the scenes, producing data for research or assisting in any ways possible. Our upcoming events of Eliza Pillar Registered Nurse of Mississippi, we are leveling up. February 19, 2022 welcomes our annual February update, hosted by our District 2, Greenville, Mississippi, the chapter that I am in. Our update will be face-to-face or virtual if the COVID-19 excels. Continue to view our webpage for upcoming events. Our annual convention, slated April 28th through May 1st, 2022 in Biloxi, Mississippi. Planning has began, and it will be in person, but virtual will be an option. We achieved our very first virtual update and convention this year. As nurses, we have tapped into technology like none before. In closing, I would like to invite the Mississippi Board of Nursing to our annual convention to keep us updated on protecting the public, as a great job everyone is doing. Joining me today is Dr. Fletcher, which is our treasurer, and Ms. Bess Blackwell, which is the secretary. Thank you for allowing us the opportunity to serve. And if any questions, please do so at this time. Thank you.
Thank you, Dr. Ford. Anybody have any questions? Thank you again for that and what you do. Are there any other members of the public that'd like to make a comment? If not, move on to O&W. You're gonna speak on
Yes, because I need to bring something for the board. So, Mr. President, I would like to make a motion that we approve the $792,500 be released to the nursing schools for scholarship funding at this time.
Any questions on that? Not, we have a motion to go ahead and pay the scholarships out of the O&W fund. I have a second. Second. All in favor? And motion carries.
Yes, I finally got signed in. I have a question whenever it's appropriate.
Okay. Go ahead. Who is this?
Yes,
We're having trouble in here, and we've heard a couple things in this.
Andre?
yeah, this is John Kalchik. I'm signed in on my mom's computer because okay, my question is that many nursing professional organizations signed on to okay, can you hear me now?
Yes.
Yeah, many professional nursing
we'll go on through the agenda, and once we get to the end, we'll try and see if we can get back in touch and let you speak then. Moving on right now, Dr. Burks.
No, we have, did you have a motion? Oh, y'all did.
Yeah, we've
that,
already
right?
done, we've taken care of that.
Medicaid Education have 3 items to bring forward to the board. The first item is Holmes Community College. They submitted a proposal request to offer a part-time night. This proposed program will utilize option 5 as outlined in the college curriculum. The option 5 coursework it will begin in the summer and it will continue for 5 consecutive semesters with the class completed in December. They also have a request to increase PM 11.24, which is a fall course, to increase that by 1 hour. They have a plan to admit 30 students per year, and this will be on the Ridgeland campus. They typically have a program there, and it also admits 30 students annually. They have a hybrid program that was approved a while back. They admit 50 every other year in August. Recently, they had 861 students district-wide, so apply for the PM program.
Hey, excuse me, Dr. Burks, the ones on the phone are having trouble hearing.
Okay. Check that.
I don't know. They'll tell me in a minute.
The Holmes Community College and their district, they had 861 students to actually apply for the program. 113 did not meet their admission requirement. Out of the 748 students did. The Grenada campus, they had 290 applicants. They only accepted 30 students. Haziesco had 120. They only accepted 30. And Ridgeland had 419 applicants. And they only accepted, 30 students. They did have documented letters of support from their community and their clinical partners, and that information is available if needed. They completed a survey, and the survey demonstrated there was a need for additional options in that area. They have support from their campus administrative team as well. Their licensure pass rate for the last 3 years, in 2018, they had a 100% pass rate on orals. 19, 84%. In 2020, they had a 100% pass rate on members. The recommendation is Holmes, if they were given permission to offer that program, they will need to refer that increase for credit hours from PND 1114 to NCCD. They will be required to adhere to the standards of the PN accreditation, as well as provide the Board of Nursing with an outcome status report. And this will be done 6 months after the initial class graduates. The second item I have is from Mr. Gulf.
Dr. Burks, does anybody, before we move on to another, have any questions on this?
Well, what is their ask? I'm sorry. What is their ask of us? Did I miss that?
Yeah,
They're asking to offer a part-time program.
Okay, I heard that again. And we have to give them approval to do that?
Before we get into the other ones, anybody have any other questions on this?
Sorry.
Okay. Dr. Burks.
Mississippi Gulf Coast, they have submitted a proposal request to offer a healthcare apprenticeship program for bachelor nursing. This proposed program, it includes the traditional training, and it actually emphasized on-the-job learning. Memorial Hospital and Senior River Health Systems, they're going to partner with Mississippi Gulf Coast if they are able to offer this program. And both these facilities have been approved by the United States Department of Labor to participate in the apprenticeship training in healthcare. The site of this program is going to be the Bryant Center, and their proposed class size, because this is an apprenticeship program, is going to be 10. Their licensure pass rate for the last 3 years has been 100%, and they received support from the healthcare facilities. What the thing that Memorial Hospital is going to do, if they're allowed to do this, is those individuals who are part of that program, they're going to offset and pay the tuition for those individuals, while also providing jobs during that time. So they'll get paid for a job and they'll also pay for their tuition. They do have a set of requirements for that apprenticeship program, and they are listed, which is very similar to all the students in the state. This apprenticeship program, it is very tedious in nature. I've supplied you all with a crosswalk of the curriculum. So if you look at the crosswalk of the curriculum, you'll notice that it outlines the Mississippi Community College Board curriculum, in addition to what this program is going to look like as an apprenticeship. Again, the focus is on on-the-job learning. So the first 16 weeks, they're going to have 248 hours. It's going to be a second 16 weeks, which is again 248 hours. The third and the fourth 16 weeks are also going to be 248 hours. They're going to have the expanded role integrated out this apprenticeship model, which is one of the requirements as well. The recommendation is that they be given permission to hire this proposal, and they will also be required to adhere to the standards of the classroom nursing accreditation. The course modules and objectives, it must reflect the integration of IV therapy, since that is a part of that expanded role. And their transcripts must reflect the equivalent courses that are required for completion in the state of Mississippi. They are to notify the board of any changes in their classroom location, because this is an apprenticeship program. If they opt to teach classes within the healthcare facilities, we will give that information, because those classrooms have to be evaluated to make sure they adhere to the standards and guidelines in terms of size. In addition, they need to also provide the Board of Nursing with a status report. And my recommendation is to be done after the second 16 weeks, and after those individuals complete that class.
Any questions on that? Okay.
I do. Dr. Burks, forgive me, but I recall this is very familiar, and I believe we kind of saw a different take on this at the last board meeting. I know, but it still addresses medical assistants. It does not tell us that they are certified. And they're still wanting to kind of do the same things, it appears. However, once again, we have no regulation over medical assistants. Bring them in and give them credit hours towards something that we have no regulation over is still a point of contention for me.
Yes, the apprenticeship program is different than them wanting to do the medical assistant. With the apprenticeship program, they're not going to receive any credit for prior learning.
So where it has in here, and I just want to make sure they're clarified, because once again, I will refer back to, it talks about prior learning credit hours over here on this second section, referring back to the July meeting.
That's
So,
the third.
Third thing, that's totally different. It's two different things.
okay,
You're talking about another program. She's gonna talk about that after this.
so I just want to clarify that they're not getting credit as an MA.
No.
And is this more geared toward MAs, CNAs, or is this going to encompass everyone?
This encompasses everyone. It is just, the only difference is they have more on the job. They're going to have more clinical hours with their apprenticeship program. What they've done is they have modeled this program out off of Louisiana. Louisiana started an apprenticeship program several years ago, and that program has been successful. So what they have done is they've taken that Louisiana model and they created this model. I spoke with Louisiana workforce to see how they do it. I also spoke with the Board of Nursing, and I've had meetings with OSHNA, because the Delgado Community College in Louisiana, they have partnered with OSHNA to create this program. And it is a little different in terms of that clinical component, because one of the things that we find is people complain about students graduating and not having enough clinical experience. So this is going to provide them with clinical experience. And the amount of time is, the traditional program is 12 to 15 months. This is going to be a 15-month program. So the difference is, instead of them doing a year, they're going to enter into a contract. This is 15 months. It is very tedious. But that focus is gonna be placing in that 27. Right now, for example, nursing student and the fractional nursing program, they have a total of 75 clinical hours, which most people say, well, by the time they even start learning, that learning experience is over. And if you see with this model, it's basically triple that in that on-the-job experience and that comes. So that's the focus of this. But it's going to be open to anyone that meets that criteria. They'll have to have an age from a background check and the ACT in addition to the T, which is the standard admission criteria for most of them.
Great. Just, we're still having a technical issue with nobody here. I don't know how to cut that mic. There's got to be some buttons to punch somewhere and make it more sensitive and turn up the volume.
I think they just wanted her to speak up a little louder.
Yeah.
It's like at church, you have to almost eat the microphone if you're gonna sing a solo.
Oh, that's not you. It's right here. Oh, that's you.
And so thank you for clarifying that because
Yes,
it
ma'am.
does make a difference and I get where that's going. So I appreciate you clarifying that section because when I was reading it, that was my concern is making sure that we're encompassing everyone that has the ability to enter this type of program.
Yes, the apprenticeship will accomplish everyone. It's not focused just on medical assistants, but they will have to meet that admission criteria in order to be a part of this program. And that's the thing as well. I forgot to mention that. They're going to sign contracts and have specific contracts because it is so tedious that they understand the expectations of this because the hospitals are willing to commit to these individuals in paying their tuition, as well as allowing them to work in their facilities and pay them a paycheck while they navigate through this program. And their goal is hopefully once they do this, those individuals will stay there and work as nurses because they're vested, and then they will return to school and transition to become RN.
Thank you, Dr. Burns.
But they're not obligated to hire them after it was over with, right?
Yes, that's going to be their plan. They want them to stay.
But what if they get in there and they don't like their,
All of that is going to be outlined in their contracts.
And I do have a question. What is the college's, what's their target market for this? Is it the high school students that are thinking that they want maybe to come into the nursing program, or is it workforce development,
It's
people
pretty
that out
much
of
workforce
job?
development because you have individuals that are working in facilities. They desire to be nurses, but they cannot afford to quit their jobs to commit to a program. So this is an opportunity for under workforce for
Okay.
them to help those people who have a desire. And because we know, for example, I'm going to use the group CNAs.
Mhm.
There are a lot of facilities have wonderful CNAs. They would love to go back to school, but financially, it's not realistic for them. So that's the group that they're looking at and focusing on those individuals who are in the workforce. It doesn't matter what department they're in, but they have a desire, have the ability, and can meet the admission criteria.
Dr. Burks, is and just recap real quick, is the prerequisite and admission requirements the same as the traditional class?
Yes,
It's the same prerequisites. And then as far as classroom hours, will there be any classroom hours at all, or is this 100% on the job?
no, their classroom, they have the theory component, but they're going to be in the classroom.
Sorry, I didn't make sure. Okay. All right. Thank you.
It's just that they are going to have more of the clinical component. It's going to increase those clinical hours.
Same flex to become an LPN once they complete the program.
Yes, they have to pass NCLEX to become an LP.
You mentioned talking back and forth with Louisiana and Skull doing this. Are there NCLEX rates? What are their success rates look like?
100%.
Any other questions on this specific? All right, now we get to move on to the other.
Yes, sir. The last item, this is a follow-up on the request from the July 2021 meeting for Mississippi Gulf Coast Community College. They requested to offer that medical assistant to the PN option. And I just did a recap and placed that information on there that will show their proposed request in addition to the program hours and what's outlined in the PN curriculum. The question asked from the board was regarding the preparatory schools. Were they required to adhere to the framework? Those schools are not required to follow the established curriculum that the community colleges use. If those schools are not accredited, they may follow the guidelines set by any certification company. For example, they use CCMA, NHA. There are no laws or regulations that can make the preparatory schools utilize MCCB curriculum. They use the industry standards. Those programs have no set time frame. MCCB curriculum, they either have a 1-year program or a 2-year, and that's depending on if the students are going to receive a technical certificate or if they're going to receive their degree afterwards. So from a preparatory standpoint, the program can be 4 months, 6 months, 9, or up to a year. And then there's no required total contact or program hours. So the amount of time they stay in class is varied. If they are accredited, they follow the quality standards set by the accreditors. My concerns are still as before. This curriculum, it differs from the approved standardized curriculum. This request includes a hybrid format. The traditional program is 100% face-to-face. They want students to utilize prior learning credit, which is not an option with the traditional PN program. And it is slightly revised in terms of how they teach that information as it relates to IV therapy.
All right. Any questions on that?
I will still refer back to, we have no regulation over MA. And for my point of contention on this is we don't know what they've been out there doing. There's no reporting body, and we're gonna allow them to have easy access into a nursing program in which at the end of the day, we will be responsible for it. And that is an issue to me. Now, if we're talking about someone that's certified and is being regulated, I'm more open to that discussion. But if we're not, we're going into an area that I'm not comfortable with, if that makes sense. Are they open to the discussion of doing this differently?
I'd asked that question before to them, and they really wanted to go with the model in which they presented.
We'll address them individually. On the first request, Holmes Community College to offer a part-time night and weekend program for the LPN. Have a motion to approve that. Have a motion, Ms. Nancy Johnson, second. All in favor? All right, motion carries. Next, we have the Mississippi Gulf Coast Community College proposal to offer a healthcare apprenticeship program for the practical nurse. That motion to be approved, that apprenticeship program. Pass 100% Patrick. Ms. Jackson, Culpepper seconded. All in favor? Motion carries. For the last one, there still seems to be questions on this. So I think to put it to rest and say that it's not going to work like this. We have a motion to deny this request.
I will make the motion. To deny.
Have a motion, a couple seconds. I think Ms. Jackson spoke first. So all in favor? Motion carries with none. Thank you, Dr. Burke.
Thank you all.
We've had all those requests. Was this prompted by COVID? All this?
You know, really just now we're getting the meat and bones of us taking over that career. Business meeting minutes July 23rd. Have a motion, make that motion. DJ second. Second. Jeremy, all in favor? Resettlement proposal set for July 2021. Motion TJ.
Second.
Second, Jeremy, all in favor? Board hearing panel minutes from June and July 2021. Accept those. Motion TJ. Second. Second, Jeremy. And waive reading names on motions. Motion, TJ? There. We'll give this a bit, Sheriff. Ms. Jackson, second, all in favor. All right. Agree settlement proposals upcoming December 7th, disciplinary hearings 8th and 9th, and business meeting be December 10th. The panel members for this upcoming one are TJ Adams, Nancy Johnson, Shirley Jackson, and Jamie Clanton. Legislation. Right, what you got? We're all gonna be.
All good. We'll start off talking about, on a high note, marijuana, medical marijuana. Actually, I think most of y'all are probably tired of hearing about medical marijuana, as are the governor, lieutenant governor, speaker, members of the legislature. However, it's out there. I got to visit personally with Lieutenant Governor last evening, and also Speaker Gunn. I was at a small gathering of folks, and yesterday afternoon, Speaker and Lieutenant Governor sent a notice to Governor Reeves stating that they had reached an agreement on the terms of the medical marijuana bill. And you know, it's been a back and forth. I mean, everybody thought it was going to be somewhat easy, but it's really been a lot of back and forth. It's taken some time, but Speaker told me very clearly they had agreed on terms, and that something was sent to the governor yesterday. In our Constitution, the governor has total control whether or not to call a special session, and he also controls what goes on that special session. So now we have Governor Reeves to determine if and when he will call a special session. I assume that he will. I would think it would be in the near term, but obviously we'll let him make that call. So I'm not going to try to guess it, but I would think it will be in the near future. Just as a side note, I could go through the terms. I shared the draft bill with Phyllis and Shannon and Brett, some of our people, but I think nurse practitioners would be included in issuing certificates or certifications like physicians for people to go and purchase at these so-called dispensaries that would be located in various communities around the state. Of course, that's permissive, mandated, of course. So I just wanted to mention that as a side note. So we'll see what happens. I mean, there's a lot to it. I mean, I think everybody you talk in terms of medical marijuana and treating children and cancer patients. I think there's a lot of support where it can get, Phyllis, as we've discussed, a little more out there is people that may want to be using it for more minor problems or other things. But I think the legislature, from the draft I saw, and it's subject to change, obviously. It looks like they worked hard to try to tighten all that up. This is much tighter than the initial Initiative 65, which the Supreme Court, struck that down. That's what kicked it back to the legislature. So we shall see. On a good note, and I was mentioning our director earlier last evening, I was talking to Lieutenant Governor. He has got a bill drafted already dealing with additional compensation for nurses due to COVID and the extremely difficult working conditions and retention. He used the word trying to keep these people. And I know the Board of Nursing and Phyllis and our staff have worked very hard along the board. We want to keep our people here. We want to encourage new people into the profession, but this may be a good way to do it. So there's been a bill drafted. Lieutenant Governor, I can tell you, he's serious about it. He wants to move it. I would think Speaker Gunn in the House would be open to this. I really do. They will get support. I think they would probably use some of the COVID monies. We call it ARC monies, the recovery plan monies for that. So that, I think that potentially a good news for us. Something that I had not heard before, I think we talked about it in the past, is the Lieutenant Governor last evening also mentioned he has drafted a bill, or had a bill drafted, I should say, to incentivize our nurses to stay in state. And just as the physicians have had a program for several years, we'll pay your education or subsidize your education expenses or costs if you agree, say, 3-4 years to stay in Mississippi. And he's got a bill drafted to do that for nurses. So I was really excited to hear that. I think that's a very positive thing. It doesn't seem superficial in my discussion. He seems committed to wanting to do that. So I think that would be very positive for our profession. And so that's something we'll be looking for this session.
Is there any way to cut on the mic or cut it up or do anything? Because we hear you here, but nobody else is hearing. And that doesn't seem to raise any volume either. But even the remote one, we still hear the same amount.
I've got a question.
Yes, go ahead.
Okay, Trey, would that also include some additional compensation or training for the nurse educators? From my understanding, the problem in the past has been that there aren't enough nurse educators to teach these students. Would it encompass anything?
Have not seen a draft. The Lieutenant Governor did not mention. My feeling was it was more about the frontline workers in our hospitals and, clinics. Certainly, I agree with you. I think we've got to keep competent and sufficient numbers of nurse educators. I don't know that this will address that, but once the draft comes out, I can see precisely what the language is. And if it is, I'll certainly let the board know that. But I think it was more targeted to the people actually in the hospitals and working. Another interesting issue that greatly impacts healthcare in Mississippi is this Medicaid expansion. You guys know there's some strong feelings on both sides of this issue, but I am hearing more and more talk from legislators, both parties, that about doing something. Some people don't like the term Medicaid expansion. It may be a form of that or something to help expand those that are not covered currently by some type of health care. Obviously, the state has to be fiscally responsible, but, Mississippi, we get almost a 4-to-1 match. It's between 3 and 4-to-1. So every dollar we put in, we get almost 4 back, but you still have to look at that dollar that you got to put in. So having said that, I know the Lieutenant Governor is at least open to discussion or dialogue about some form of expansion. I can't speak, how far that would go or what it would do, but I think he's open to it. And I'm just starting to sense, the Mississippi Hospital Association has been out front pro Medicaid expansion. Now, Mississippi State Medical recently, I think, came out and made some statements that I think it looks like they may engage to some degree on being supportive of Medicaid expansion. But there again, we'll just have to watch and see. But I did want to mention that I do anticipate we're probably going to have some hearings later in the fall, probably Senate Public Health Committee. This is just what I'm reading between the lines, that we may have some hearings later to discuss this issue and related issues. So I'll keep the board posted. Last, but certainly not least, another thank you to Shan for all her good work on the budget. Phyllis is input working and those guys and all of our staff putting together an excellent budget request to the legislature. I can assure you, and Ms. Collins knows with William, her son, working there, these budgets are not just merely glanced over. They're analyzed line by line, which is crucial. And we've because we've worked hard and had folks putting it together, we've been engaged at the Capitol. We've done well with our budget in the legislature. I thank them and the leadership for working with us on our budget. But I wanted you to know there's a lot that goes into it. And I think we've got a very strong budget request that we're going forward with in this next 22 session. That concludes my report. If anyone's got a question, I'll be happy to answer it.
Any questions?
If not, thank you. At the next meeting, if it's legal, I'll try to bring some samples for y'all edibles. Just kidding, just kidding. Thank you. The retreat, okay.
All right. Executive Director report.
Good morning. My report will be brief. I have it before you and hopefully everyone, I do apologize for those that are on Zoom. Hopefully you can hear me. My voice tends to carry. So we will try and rectify that situation going forward, but you do realize that we are having hybrid meetings. So there are, you can attend in person, but we do limit our number. Going forward, if there are individuals that would like to attend in person, please email me. And I will let you know whether you will be able to attend based on the number. With the numbers going down with our COVID situation, hopefully we'll be able to allow more individuals in. But I do apologize for the inconvenience. Going forward, just a few updates. One of the things that I would like our board members, and again, thank you for your leadership and all that you do each and every day, board members. The Board of Directors retreat, you know, we had this unfortunate weather situation to occur, and we had to postpone that. And we would like to reschedule that. So we're asking the board members to give us a date. I've spoken with the chair about this prior to the meeting. We're looking at January as being a good time because that's an off month for us to hold hearings. And that will give you all enough time to schedule if you could come to a conclusion today, because we need to, again, lock in a venue for the board retreat. And I think it's very important that we go forward with the retreat. We do have some excellent speakers still waiting on us to get back with them on a proposed date because their schedule gets booked pretty quickly. So I would indulge the board to please try and give us a date as to when we can have the retreat, at least today. The second thing is there are some kudos in place. I am so proud of our board of directors and our staff. Ms. Nancy Norris Johnson has been appointed to the NCSBN Nurse Licensure Compact Training and Education Committee, and we're extremely proud of that. In addition, one of our staff members, Dr. Burks, has been appointed to the NCSBN Nurse Licensure Compact Research Committee. And we have other staff that are also, Ms. Culpepper, and who is a board member, as well as Sharon Russell, who is one of our staff members, have been selected to the National NCLEX Item Review and Development Committee. So I am so proud of our board of directors, our staff, for being involved at the national level. It speaks volumes about the leadership that you all provide for the state of Mississippi, and we're at the table. And so I think that's very important. So I encourage those that have not, even our new members, going forward, and I'll send you that information out, that if you're interested, now is the time to get involved. I also would like to recognize Mr. TJ Adams, who is our board member. TJ received a promotion as administrator at North Mississippi Medical Center in Tupelo. So we are indeed proud of him and his accomplishments. Again, speaks volumes to the leadership we have on the board. So congratulations to each and every one of you for those accomplishments. The other thing that I would like to bring forward is MEC Hobnob. That will be conducted October 28th from 8:30 to 1. If you are interested, I know it's short notice, but we just got the email, I think yesterday or day before it was sent to me. We do attend that. We are members of the MEC, and we will be sponsoring a table for that event. It will be held at the Mississippi Coliseum this year. They're going back to face-to-face. So it's an excellent opportunity to meet your legislators, to hobnob and network with other industry and business. But this is an excellent opportunity. Highly encourage it. If you're able to attend, please send an email to Vanessa Gray, my executive assistant, or me. You can CC me on that. And we will make sure that we get the appropriate number of seats so that you can attend. If you've never gone, I highly encourage you, if you can, participate in it. It's a great event. You see on the board visibility, we've been very active since our last board meeting. Upcoming, we have the M&A conference. We have Brett Thompson May and Tina Hatfield will be presenting at that conference to represent the Board of Nursing. And Dr. Burks will be attending the Community College Board and Department of Education Regional Collaboration meeting later on this month, I believe. As you know, we do have the PN educational program, and Dr. Burks is intimately involved in anything dealing with that. We don't have a lot to do with the curriculum, but we do. So she'll have input also into those curriculum conversations they have with the Community College Board as well. And we have lifted our travel restrictions here at the board. So the staff as well as board members, if there are conferences coming up, please let us know if you're interested in attending, because the travel restrictions have been lifted. There are certain guidelines that the travel companies and airlines require that you will have to meet, but let us know if you're interested. We are allowing our staff now to go to conferences that are being held in person. And I'm being told that probably in March, and I'll send you all to save the date, which is our mid-year NCSBN mid-year meeting. That will probably be in person. And I think it's in St. Louis. I sent the save the date yesterday, I believe. I think it's gonna be in St. Louis. It'll be in March. I will send it out to the board members. So if you're interested in attending that, you can go ahead and plan accordingly. And Mr. Chair, that's all I have at this point.
Thank you, Dr. Johnson. Any questions? Shan.
Righty, good morning. 1 minute. I am, Dr. Mary Stewart is out today, so I will go over the budget. Although the fiscal year ends June 30th, the agency had until August 31st to finalize everything for fiscal year 21. A summary of the year included the board collected $6,836,291 in the revenue year. The expenditures for that year totaled $4,346,141.39. Remote working due to COVID decreased our travel expenses and commodities. And as Ms. Johnson just pointed out, that will likely increase in the upcoming budget month. Expenses were lower than the amounts budgeted in every category except for contractual services and equipment. The reduction in those areas made the overages possible. Since revenues were higher than expenses, the board was able to carry a large amount of cash into fiscal year 22. Fiscal year 22, the spending authority began July 1st for $5,189,911. This includes additional appropriation of $22,876, which will become available January 21st, 2022. We did receive the salary amounts from the State Personnel Board, which is over this $22,000 amount. We do have the funds, so we will plan on talking with our LBO analysts to increase that so that all of the 3% increase that we've discussed over the months will be able to be included. The agency has included this in the internal budget, which is what I just said. This will, I lost my place. This amount will not be added until in the accounting system until January 1st, 2022. Travel expenses are still much lower than the budget year due to COVID. The other operational expenses are expected to be the same as last year. The agency will purchase a vehicle this year. I did mention in the executive committee, we kind of put that on hold because they have few cars. The inventory is very low. So we will probably look back in January to start looking at vehicles for the board. Revenue appears to be higher at this point than in the last two preceding years. Again, you guys received the individual budget. If you have any questions, comments at this time?
I have a question. Shan, with I mean, I understand the reason, but with there being such a vast difference here in revenue versus expenditures, is that putting us at risk of having a sweep by the state? Is that, is it one of those things that, if you don't spend it, you lose it type thing? What can we do?
I'm glad you asked that question, Jeremy. That I do try to remind the board of directors and the staff that if we don't spend it, we do lose it. We stand to be swept. We've been swept once before. We're not immune to being swept as an agency. I do encourage when we send out the notice, if there are any projects, any initiatives that the board needs to be doing, whether it's through Office of Nurse and Workforce or through the board and staff, then we need to get those justifications in so that we can utilize those funds in the best way to spend them, because they will cut the budget. So, thank you, Chairman.
Any other questions? Not. Have a motion we accept the budget report. Second. Jane, all in favor?
Done with that motion. I forgot, I just wanted to mention to you all about the temporary permits. I know you're probably going to talk about it. I know we discussed it in the executive committee, but I have been doing some research on the temporary permits that we have offered during the COVID era. We were able to offer over 434, actually a little over 500 permits to our graduates, endorsements, and retired RNs. And basically, my study dealt with the new graduates, particularly the ones that went to school in Mississippi. There were 434 permits that for Mississippi graduates in Mississippi that we gave out. And we were looking at, did their ability to come out and work prior to taking the NCLEX, did that affect their ability to pass the NCLEX in practice? And the study was significant in that approximately 82% passed NCLEX on first right. These were nursing students that came out and worked for 120 days, maybe more, prior to taking the NCLEX while waiting to take the NCLEX. It showed that a significant amount passed NCLEX on first right. Of the 78 that did not pass on first right, they were able to pass it when they went back and took the test. So the study has shown a significance in that. I think this is something we can continue. It is already in our law. For whatever reason, at some point, it was not being done. I had stopped being done. And so I know Mr. Chair will probably bring that out from the executive committee, but I think that's significant. We were able to put approximately 360 new grads working here during a time when we needed them. And so I think that's a good recruitment tool. Some of the hospitals have been behind it. They've contacted me. They want to see it continue for the new grads. I've gotten emails and calls because under the emergency declaration, you all extended the temporary permits, COVID permits through December. Well, this, you won't have to do that anymore. We already have it in law. And, we would, are recommending that we be allowed to issue this in accordance with the law to our new grads and some endorsement apps. It's already stipulated in the law who those are. And we have disaster temporary permits for people that may need a temporary permit that are not part of the compact to come in to work under the public health emergency. That's already in our law. So that's all we're asking, that you all consider that and made a recommendation through executive committee to continue that. But I want you all to have that data. Some of the hospitals have even paid for their new grads to take the NCSBN review course prior to taking the NCLEX. And that's a recruitment tool for those hospitals to retain those individuals. So I think it's significant. Just want to give you that data. There's more to come. There were 49 nursing students that live in Mississippi, but went to schools outside of Mississippi. They were not included in the study, but we're assuming that they stayed in Mississippi once they took NCLEX and passed it. That's more. We're going to be working with Office of Nurse and Workforce to do some surveys to try to find out if we retain a sufficient number of these people in the state of Mississippi. That's a pocket of data that we're missing, but it's implications for additional study. So I just want you all to be aware of that.
Phyllis, does that prove kind of that on-the-job training and clinical? Maybe there's something with the curriculum in nursing school that they might need to adjust to maybe more time for clinicals?
Well, clinical is something that is very important. COVID has impacted that. When I came out, which was umpteen years ago, we were able to do this prior to taking NCLEX. And I think it helped us. I think that you learn the theory and you don't know all there is to know till you actually get out there and get your critical thinking skills and the theory and the practice and put it together. And then you're able to think through the exam questions. Because the NCLEX is only minimum competence. If you can't pass the minimum competency, that's a concern, because I think, but I think this will help. It looks like it has helped, and there has been the industry, healthcare industry is liking it. And so I think that's important, it's significant, and I think, again, that's a reflection on you all as the Board of Nursing, that we've implemented this, we've shown that it's worked based on the research that I've done thus far, and there will be additional studies coming out of this, I'm sure. But I just think it's very significant that that we were able to show how many pass NCLEX on first right.
Are we the only state that has done this, or is there other states that are doing this?
There are some states that offer temporary nursing licenses. They have different stipulations in accordance with their law. There's been a lot of conversation about with COVID, because again, that's another lesson learned, that there are things that have been put in place that probably need to be looked at to continue. And so right now, there are some other states that are doing it, but I don't think they're doing it to the extent that we're looking at doing it.
Trendsetter.
Right, exactly. That's my word, trendsetter.
You mentioned the 82% pass NCLEX pass rate. Do you know a percentage number that compares to prior to the permit?
Now, Dr. Burks will probably have that information. She might research mine first.
That's
Do
a
you
question.
have any idea of what the NCLEX pass rate was? Was it prior to implementing the temporary permits among graduates? It's going different from school to school, I'm sure.
Statewide, it was in the 80s for the year, last year for the 2020.
So let's just move right into the executive committee report, which this encompasses. Dr. Johnson, you mentioned as far as temporary permits, you're looking at using state law that's already in place to devise a program under. How long would it take to get that implemented?
We are fully functional. We are looking to have an effective date of December 1.
Okay, so I just make sure we didn't need
Or to give us that permission as of December 1 to incorporate that.
We're speaking of temporary permits expire December 1 is what we extended them to. Just want to confirm they would have that going before extending. So with that said, coming executive committee would ask that we allow Dr. Johnson, direct staff to implement a permanent program around temporary permits. Sanders, second. TJ, all in favor? Motion carries. There's one other thing that's come up with a question, and this is more of a comment dealing with the different organizations that have come out, and some of them saying that, if you do misinformation and stuff like that, that there will be questions and you'll be called in. We already have in our rules and regulations concerning professional conduct. So if there is some type of gross negligence, something like that, that rises to that level, then it can be addressed through that. But this time we have no intention of putting out any type of paper comment about that. Correct. With that said, that ends executive committee report. I understand this is fixing to be a little long. Compliance committee.
Thank you, Mr. President. So we'll make this brief, but the compliance committee was very busy today, and we took our whole hour and needed a little more time. But I move that the board adopt the compliance committee's recommendation that the following affidavits, formal referendums be accepted for ratification. License number R849303. I move that the board adopt the compliance committee's recommendation to deny the request of license R-914993, request for early release from her 24-month probationary period, pursuant to the final order dated and signed February 7th, 2020. I move that the board adopt the compliance committee's recommendation to approve the request of license number R-882251, request for modification of the final order dated and signed April 23rd, 2021, of the maximum number of hours allowed to work from 88 hours to 96. I move that the board adopt the compliance committee's recommendation to approve the request of license number R 629871 NP request for an extension of the requirements of the final order dated and signed June 15th, 2021. The committee is granting a 30-day calendar extension on the $1,000 fine from the date of approval. The committee is granting a 90-day calendar day extension of the legal aspects of nursing course from the date of this approval. I move that the board adopt the compliance committee's recommendation to approve the request of license number R 861879, request for modification of the final order dated and signed October 18th, 2019. The maximum number of hours allowed to work from 88 hours to 96 hours. I move that the board adopt the compliance committee's recommendation to approve the request of license number R 860437, request for an extension on the requirements of the final order dated and signed July 20th, 2021. The committee is granting a 30-day calendar extension on the $500 fine from the date of this approval. The committee is granting a 30-day calendar extension of the ethics course from the date of this approval. That's it.
All right. You heard the motion coming out of committee. Any questions? All in favor, accept the committee's recommendation on the motion for us. Say aye. Any opposed? All right. I will want to back up and add something and ask a question. As we're going through here, check the dates of January 10th and 11th, January 24th and 25th. That's keeping it on a Monday, Tuesday, as it was before, and just see if anybody has any direct conflict at this time.
Give me those dates again.
January 10th and 11th, and then the 24th and 25th for doing the education session.
What days of the week are they?
Monday, Tuesday. Yeah. Anyway, we're moving on. Advanced Practice Committee. I know she's on the phone, but there seems to continue to be problems. If she just texts me again, as far as being able to hear. Dr. King, you there? If not, there's nothing to come out of advanced practice. But they're saying officially. Practice committee. Was there any conflict? Practice committee had?
Wonder why it has a motion.
All right. Administrative code, that's just getting taken over. Finance, Shannon's taking care of that. O&W, you've already spoke to that one. Have a motion, go in closed session, to determine if executive session. Have a motion, TJ, second. Second, Jeremy. All in favor? Good. All right. We will now go into closed session to determine if executive session is necessary. So, everybody get out.
Out of executive session and unmuted.
We're out of executive session. We're just waiting for order to get fired back up. Review information related to employee performance and just salary reporting. At this time, we'd like to ask for a motion or just basically declare us in recess until we return for the full board of people. Anybody got any questions? That we can step over here to the other room shortly.
We are in recess.
We're in recess.
Hello, Ms. Hill. Ms. Hill.
But you will need, oh, here's your stuff for the full board.
I just wanted to make sure you knew that we were in recess. And as soon as we come back, you can leave your camera on.
I don't even know who made the motion. All right, man. Here's all of my motions from the meeting today, because I'll be recused on this one. Good luck reading it. I try to look.
I rely on you sometimes.
Okay, so you'll see where it says request one, that's in regards to the handout. Yes, behind the request, so that you know. See, I have request 1, 2, and 3, so that's gonna go
Hey, Ms. Hill, can you hear me?
now.
Okay, I'm sorry, I can't hear you. Let me do some adjusting here. We've got to make sure we can hear you during the hearing. Ms. Linnell, can you hear me?
But
Can you say something so I can test your mic?
Yes, can you hear me now?
We can hear you. So Ms. Hill, there may be some adjusting on your end. If you can look at your volume, that would be great.
Yes.
Thank you, Ms. Linnell.
Yes, thank you. Hey, how long is the recess?
It may be 30 minutes, possibly. I
Okay,
think they're gonna eat before we do the hearing. We've got an upcoming appeal next.
okay, all right. I may have to sign out for a little bit.
Okay, all right. I'll let you
All right.
back in once you join. You'll be able to join back.
Okay, thanks,
Thank
Shan.
you. Okay. Ms. Hill, did you want to try your mic again?
there's your compliance motions that are gonna be attached to that back page.
Still can't hear you.
If I can get $2 extra.
$2 extra.
for all that.
Let's see.
They're gonna tell us no
Hang on
anymore.
one second, Ms. Hill. Let me try something. I'm gonna send you a request.
Yeah, right?
Ask for 250, yeah, meet halfway.
Yeah, go halfway on it. So, I'm gonna get out of here now. Okay. Yeah, because I'm recused on this. I heard this. Are we on mute?
No, I'm trying to test this young lady.
I'm recused on this one.
Ms.
so
Hill,
I'll-
did you receive a message asking you to unmute? Still can't hear you.
Right.
Correct.
Is this the host? I got a message to unmute.
Thank you, Mr. Andre. I was just trying to test others on the Zoom to see if we could hear them. I can hear you clearly. Can you hear me clearly?
Yeah, I have a question. My question didn't get answered, and they said they got some kind of more business after they come back from their lunch. So
They
is my,
will. Yes, sir, they will. It may be 30 minutes tops before they return. But you're welcome to stay on the Zoom, and I will definitely let the board president know that you're still on. We have not adjourned our business meeting.
okay, so it'll be asked before they go into that hearing thing.
Yes, sir. And I'll definitely let the board president know that you are still on the call.
Okay, thank you.
Okay, Ms. Hill, I'll continue to try to work with you to see if we can hear you because you're muted. Muted. Can you hear us? She log out and log back in. She's tried. You want to try again to log out and log back in? Okay. You can try it again to log out and log back in. We can't hear you. You would just log out again and then come back. I'll let you back in.
You may have to change your microphone selection. If you click on by the mute button, there's an arrow. Usually at the bottom of the screen. That bar comes up and there's a mute button, there's an arrow, and you may have to select a different microphone.
Okay. Does that one work?
Yes.
Okay.
Thank you, Nell.
You're welcome.
Thank you.
You're welcome.
Bill, if you want to mute until they come back, you can. Don't change anything. just mute. And then when they return, I'll send you a message to unmute. All right, thank you.
So if we can get that. if I get that position filled.
Can you hear me? You are muted still. You hear me? Mike? And speak? Still shows that you're muted, Miss Hill. We can't hear you.
Okay, I'm here.
Oh, there we go. All right. With that, we will go ahead and resume the session. I'm out of recess for the purpose of the full board appeal from Ms. Genesis Hill.
Could y'all cut that off?
This time, I will turn it over to Mr. Everett.
All right, thank you, Mr. President. I see that the appellant, Ms. Hill, is present. Are you represented by counsel, Ms. Hill?
No, I'm not.
Do you have any witnesses?
Any witnesses? I'm sorry, I'm having difficulty hearing you because the air conditioner's on.
We have that.
Did you say, do I have any witnesses?
Disregard. Okay, can you hear me better now?
Yes.
Okay, very good. The board panel is here regarding an appeal to the full membership regarding license number R8922414. This is case number 2018-0041. It's my understanding that there was an original complaint filed in September of 2020. A final order was then issued in February of 2021. The appellant, still feeling aggrieved, perfected her appeal, and that is why we are here today. With appeals before the board panel or the full membership, 7 members are required to be present, 3 RNs, 2 LPNs. These appeals shall be limited to the record of the hearing before the board hearing panel. The full membership of the board shall not retry the appealed case. Arguments are to be directed solely to issues from the record of the transcript that results in the appeal decision and shall not include new evidence, testimony, or witnesses. The respondent, appellant, and appellee shall be allotted 20 minutes each to present arguments why the decision of the board panel should be overturned or affirmed unless otherwise ordered by the board. The appellant may reserve a portion of her allotted time for rebuttal. By that, I mean, if you, with your 20 minutes, if you want to use 15 for your argument and reserve 5 for rebuttal, you may do that. You just need to let us know what you're going to do. You are not obligated to use the full 20 minutes. The board may terminate the argument when in its judgment further argument is unnecessary. The appellant is entitled to open and conclude the argument. Parties will not be permitted to read at length from briefs or records. The board may in its discretion advise the parties upon points which it desires to hear argument. Members of the board may ask questions of either party related to issues identified in the appeal. Board members who participated in the board hearing panel shall recuse themselves from participation in the hearing of this matter. I think those members have already been recused. Although a decision of the full board may be announced following deliberations, the board may be provided adequate time to prepare a written order, which will be submitted to the parties. Do we have any questions before we get started?
Just the preliminary matter.
Preliminary matters, council?
Yes. Ms. Hill, we are about to admit the exhibits in this full membership appeal. I need you to verify on the record that you've received those exhibits A through G.
I have.
At this time, the state moves that A through G be submitted as evidence for the record and in this matter.
Ms. Hill, do you have any objection to those exhibits?
Are these just the exhibits that are included in my transcript here?
The exhibits that were emailed to you regarding the full board appeal?
Yes, and I have those as well. I have those as well.
Do you have any objection?
I do not, but I do have a comment on a statement that was made by the nurse practitioner.
And I would have to object only because this appeal process, Ms. Hill, does not allow the board to retry any evidence before it.
Okay.
Ms. Hill, just for clarification, all we're trying to do today is for you to have an opportunity to explain to the full board why you feel as though the board panel decision should be reversed.
Okay.
With no objection to those exhibits, they will be admitted. Ms. Hill, you will have an opportunity to present your argument first. Then we will hear from the state. Should you decide to reserve some of your time for rebuttal, you will then have an opportunity to speak again. Do you intend to reserve time for rebuttal?
That's fine.
How much time do you intend to reserve?
At least 5 minutes.
That'll be 15 minutes for your argument, 5 minutes for rebuttal.
Okay.
All right. You're ready to proceed, you may do so.
Okay. Do I start with the exhibits to refer to them, or do I just give a summary?
One moment.
I'm sorry, I cannot hear you.
We need to have you sworn in. If you raise your right hand.
Okay.
Do you solemnly swear that the testimony you're going to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you, Ms. Hill. You may proceed.
Okay. So in these exhibits here, it basically states that there's so many different things. It basically says that I was accused of looking up someone's husband, another employee that was actually in the middle of a divorce, said that I looked up her husband on PNP, on my computer, that there was an audit trail done and everything. And because there was no video cameras, I couldn't prove that it was not me. And in the statements from, there was a statement from, it just said an office RN, it didn't say who. There was a statement from the girl who was getting a divorce, Jessica. And then there was a statement from the nurse practitioner. And I guess the biggest thing was where the nurse practitioner said that I was the one with her login credentials. We actually all had a 3-ringed binder from the day I started at that clinic, and it had all of the logins that we had to have for prior authorizations, for PNP, for anything. It had their NPI numbers, their DEA numbers, everything like that. Everybody had one of those at their computer. So that statement was absolutely incorrect. Also, the statement from my coworker where she said, you know, that she mentioned it to me, that she was getting a divorce and that I said, she said that she wanted to know if her husband was on drugs. And I said, oh, I know a way we could find out. I definitely never said anything like that. She and I were not even close there in that facility. She worked on one side with Dr. Fredericks as the MS coordinator, and I worked on the other side with Dr. Scarf and Christy Callahan, nurse practitioner. So that was also false. And I didn't know if I could have character witnesses. I did not think I could have any witnesses here today to speak on my
That's
behalf.
correct. That's correct. You could not.
Okay, I didn't think so. But that's my biggest argument.
Okay, Ms. May.
May it please the board. We are here today on the appeal of Ms. Hill. Ms. Hill is the appellant in this matter. The board is the appellee. She is appealing this matter, claiming that she did not know about the hearing. And certainly you've heard her argument today in defense of what she brings before the panel. I want to start by explaining to the board that there is a standard of review that the full membership must follow when it reviews any board panel case. That standard of review involves 4 principles, and it's well settled law. The Wilson case, which is a Supreme Court case, along with Hansen, which is another Supreme Court case, and in fact, both cases involving the Board of Nursing, sets and delineates what this board must look at when reviewing previous decisions. It must be determined that the decision that the board panel made was supported by substantial evidence. It must be found that the decision was not arbitrary and capricious. It must be found that there was not a constitutional right violated of the nurse or applicant, as it may be. And finally, it must be that the decision made was not beyond the power for the board to make. So those 4 principles here are at play when we are looking and reviewing a panel decision. So when we look at due process, let's start with due process. Due process was established in this matter. The board panel did everything right. Ms. Hill, for whatever reason, was not present during her hearing. That hearing was in December of 2020. How due process was established and affirmed from the panel was that we had a bailiff, Mr. Floyd Wiley, who did what he does during the board hearings. He calls the name of the respondent 3 or 4 times in the foyer, downstairs. He checks Zoom to make sure there was no one located on the Zoom to be available and present for the hearing. Once that is determined, that's not all. Mr. Wiley raises his right hand under oath and is questioned by the state attorney and asked a series of questions to make sure that the board can establish that due process exists. So what is that? Simply this, that the board staff has sent the respondent a complaint and notice by certified mail. If that complaint and notice cannot be substantiated to be received by certified mail, the statute goes farther to explain that the board is authorized then to publish in the newspaper in the county where the nurse resides 3 consecutive weeks. This is the case here in this matter. This matter was not only sent to her certified mail address in Kosciuszko, but when that envelope came back unclaimed, the board then followed the statutory process and published in the proof, as you would find in the proof of publication in the Kosciuszko paper. That notice was for 3 weeks. The statute goes on to say that a hearing then cannot be any sooner than 10 days from the last date of publication. Indeed, that was met. Ms. Hill's hearing was on December 10, 2020. Once the state can show that due process requirements have been met, all the evidence is then admitted into the record. Once that evidence is admitted on the record, the state rests. The board hearing panel deliberated. They could look at that evidence, read that evidence, and then decide whether or not that nurse is guilty or not guilty. We don't know why Ms. Hill didn't show up that day. That remains the big question. But what's interesting is that the complaint was sent to her Kosciuszko address. The notice of this hearing today was sent to her Kosciuszko address, the same address where the envelope came back. And the brief that was written on by the state was also sent to that same Kosciuszko address. So curious as to why she wasn't present, but that doesn't matter. What matters is that the due process requirement per the law, that requirement was met, okay? Secondly, the board has to establish that substantial evidence was there to substantiate the charge. Ms. Hill was charged with unprofessional conduct. The specific charge was found in our administrative code in that she violated confidentiality of information or knowledge concerning a patient. The facts of this case support, and the board panel got it right when it found that clear and convincing evidence existed to find her guilty of that charge. Here are the facts. We have a report from St. Dominic that the day that that pharmacy profile was accessed, the credentials of the nurse practitioner was utilized. That nurse practitioner was absent that very day that that profile was accessed. Ms. Hill was assigned to that NP. She was the NP's nurse. The facility conducted an investigation. They had an IT audit performed. All of that information was submitted into the record for the board panel's consideration, and the board panel found that indeed was clear and convincing evidence to find her guilty of the unprofessional conduct that was alleged and confirmed. Third, the decision was not beyond the power of the board to make. The statute's clear that when the board panel finds a nurse guilty of the violation, then it is authorized to impose discipline. That discipline is clearly delineated in 7315 subsection 2. That the board can discipline a nurse by reprimanding them, fining them, suspending them, asking them to take educational classes, revoking them. All of that is statutorily authorized so that this board, when they find a nurse guilty, can impose those sanctions. The board was not beyond its power. And then lastly, the board's decision or the board panel's decision was not arbitrary and capricious. What does that mean? Case law is clear. The Hansen case, the Wilson case, when it states arbitrary and capricious means when it is done without reason. There's not a factual or legal nexus between the facts as applied to the law. When something is done arbitrary and capriciously, it can't be justified. It can't be proven. Here in this matter, the facts with the evidence that was admitted, it is clear and it should be convincing that Ms. Hill committed a violation of the Nurse Practice Act. She accessed that PMP. She accessed that PMP when her nurse, NP, was not present. She violated the confidentiality and violated privacy, for that matter, of the patient she was accessing. Because quite frankly, that patient, as you will see in that evidence, was not to, that profile should never have been accessed that day. Profile should never have been accessed that day, but it was. So the board did its job. The board did its job. It evaluated the evidence. It considered the totality of the circumstances. It rendered a verdict of guilty and imposed revocation as a sanction. So today, I tell you and submit to you that the board panel got it right. The board panel got it right. And that you as the full membership should apply those 4 principles we just talked about to affirm that decision that was rendered by the board panel February of 2021. Thank you.
Thank you, counsel. Ms. Hill, if you have rebuttal, you can make it at this time.
Yes, I would just like to say about the letter. I wrote in my brief, I'm not sure who all got the brief. I think everybody on the email for sure. I actually did not get that letter because I just went through a domestic violence situation. I would be glad to email you the legal papers to prove it. I wouldn't not show up for something like this if I knew about it. It's my career. It's how I make a living. It's how I provide for my children. And if I had known about this, I would not have missed it, nor would I have ignored it. None whatsoever. Also, once again, I was not her only nurse. As a matter of fact, I had turned in my notice and was going to look for another job. And she actually asked me to stay after she had already hired on a new nurse who was going to be her main nurse. So she had 2 or 3 different nurses. Myself, a girl that sat right behind me, Morgan, and then another girl that sat to the left of her, Amanda. I'm not sure why she's referring to only me as her nurse. I feel like we all shared the same amount of work. But I did have her information as well as the other nurses. Most definitely, that is true. But I had absolutely nothing to gain that would do me no good. The only time I use PMP is for our patients that we saw in clinic, and when I had to look them up and tell Christy when somebody last got their prescription filled to see if she could refill it.
Does the board panel have any questions for Ms. Hill? Ms. Hill, at the time that this notice was mailed to you, what was your address? For the
That was
additional-
still my address. I was actually in Flora, Mississippi at 751 Livingston Vernon Road. I was trying to work things out with my boyfriend, and he was going through a horrible time with alcoholism, but it didn't work. And we stayed there for several months with his family, and they could vouch for that.
So the address that I have before me is 2861 Atala Road, 1137 in Kosciuszko.
That's correct.
Okay, has your address changed from the time of the complaint till now?
Yes, I'm actually at my parents' right now. It's on 534 McCullough Road in Louisville, Mississippi.
Okay, have you provided that address to the board?
Yes, I have through email.
When was that done?
I'll have to go back. Let me see. I'm not sure if I sent it directly to Rochelle or if it was to Miss Vera. Initially, I gotta find it. It's changed since April the 5th. I had to press charges for aggravated assault, domestic violence, and go through court, and I'm still under a protection order. And so I had to move out of that address.
Out of which address?
2861 Atala Road, 1137. That's why I've been gone from there for so long.
Okay, do you know the procedure for how to update your address with the board?
Yes, I do. Online.
Okay, have you done that?
I'm pretty sure I have. I know I emailed it to whoever had first emailed me about everything when when I first found out about this. I had started a job here. I was training at Winston Medical Center in Louisville. And the DON, Dana Scrivener, called me and told me my license had been flagged. And that's when I called and spoke with Miss Vera and with Rochelle and let them know what was going on and that I would like to appeal it and started the process. And I can go back through my emails and find the exact date and forward it to you if I need to.
So what address did you get notification for this hearing today?
The 534 McCullough Road, Louisville, Mississippi.
Get the brief.
I'm trying to find the exact email. See.
Okay, do you have your exhibits in front of you, Ms. Hill?
Yes, I do have the ones from my transcript right in front of me.
Okay, can you locate exhibit F in those exhibits?
Let me go to my email with the exhibits. I don't see F in the transcript. I see B1 through B8 is the ones that are in the transcript that I paid for. But I do have them on email. I can find them on email.
So do you have a copy of the hearing notice for the hearing today?
Yes. Let's see, here it is. Okay, I can click on the exhibits. You said it's exhibit F, is that correct?
Yes, ma'am.
Okay, yes, I can locate that right now on my phone. I'm scrolling. No, I didn't miss it. I'm in trouble finding it. It goes from E2 to exhibit B2, and then it goes through all of the Bs. Is it before that? Let me keep scrolling.
I think it should be toward the end.
I see D, I see C. Notice of full board appeal. I'm on E1, so I'm thinking it's right after that.
In case you need reference, that email was sent to you August 20th, 2021 at 12:40 PM.
August the 20th.
Yeah, all of the exhibits for your appeal hearing today.
Okay, I'm sitting here looking at all of them right now because it says 68 pages. Actually, I'm scrolling through it. E3. There it is. I've got it. I'm on F.
Okay, on exhibit F, what address do you see on that exhibit?
See, it's the Kosciuszko address.
Okay, now that's the notice for your hearing today, correct?
Let's see. Meeting has been scheduled by the Mississippi Board of Nursing. Your appeal of the February 16th. Yes, that's for today.
Okay. Now, if I understand your testimony, you're saying that you did not receive the original complaint in 2020?
No, I did not. I was not even at that house for several months. I was in Florida.
Okay.
I don't know if I would have to get a police report to prove that or how I could prove that.
Well, I guess my concern is I don't see on the notices that were addressed to you that there is an address other than the Kosciuszko address.
I don't know. I would have to locate that email when I first called and spoke with Rochelle back in February. Rochelle and Vera were the first two board members that I spoke with, and I had to update my address to my parents' address because I let her know that I was not going to be there any longer.
Ms. May?
Yes.
With the notices that were sent, I see the one exhibit C was mailed by certified mail to the Kosciuszko address.
Yes.
One for exhibit F was mailed also to the Kosciuszko address via certified mail. It also indicates that it was emailed to Ms.
Yes,
Hill.
I have all of them on email right here.
Hold on, Ms. Hill, I'll let you know when I need a response.
Okay,
I'm dealing with Ms. May right now.
okay.
But my question, Ms. May, is the state saying that the notice is perfected through the certified mail or the email?
We would contend that both have been satisfied. We have communicated via email mostly because of the virtual situation. I can't argue that there have not been email exchanges, but there was an email sent for the December 2020 with the same email address as well. The state would just argue that it's the responsibility of the nurse to upload the gateway or update the gateway. And if the state's proven due process, not sure what else is left.
Okay, here is my dilemma, Ms. Hill.
Yes,
It appears you're saying you received the notice of the hearing today at the Kosciuszko address. But you're saying you did not see the notice of your initial hearing at the Kosciuszko address.
I have all of this on email.
You have what on email?
The notice of today's hearing.
Okay, did you receive the certified mail of today's hearing?
I haven't been to that address. I'm just trying to sit here and think. I don't know the last time I got mail at that address.
And it's possible if it's certified delivery there, that if she hadn't changed her address, it's not restricted delivery required. Statute only states it's got to be mail certified.
Okay. So are you saying then, Ms. Hill, that it may have been delivered to the Kosciuszko address and you just didn't pick it up?
Yes, that's correct.
So when did you update your address in the gateway?
Let me look and see and make sure that I have. I know that I when I first had to mail in my initial fees for the appeal, that I verbalized my address, or I could find the very first email back from February, but I need to make sure. Let's see. I feel certain that I did. But I want to be certain. Is it not updated on there? Is that what you're telling me? That it's not updated?
No, I'm not telling you that. All I'm telling you is that all the exhibits that I have before me only have a Kosciuszko address.
Okay, I understand. Let me make sure. I know that when I first called back in February, I let her know that I was no longer going to be at that address. And she asked me what address that I needed to use, and I told her that my parents' Louisville address.
I can actually verify on Gateway. The address is 2861 Atala Road, 1137 Kosciuszko, Mississippi, 39090.
So it's still on there?
So Ms. Hill, are you saying that you, for the initial complaint, are you saying that you did not receive the notice or you just didn't pick it up?
For the initial complaint, I was not even there. I didn't even receive the notice. I actually didn't even know anything was going on until I started work here at Winston Medical Center at the nursing home. And my DON, Dana Scrivener, told me that my license had been flagged. And that's when I called the board and asked them what was going on, because I had no idea. I knew I hadn't gotten in trouble. Nothing had happened since whenever that was, 2017. And so I had no idea why my license was being flagged. So that's why I called initially, and I spoke with Vera, and then I spoke with Rochelle to find out why my license was being flagged.
So when it's time for renewal, what address do you receive your renewals?
You said when it's time for renewal, what address do I receive my renewals at?
Yes, ma'am.
I was at 2861, but now I'm here in Louisville. So it will be my Louisville address. 534 McCullough Road, Louisville, Mississippi, 39339.
Are there any questions for either Ms. May or Ms. Hill from the board panel? Go ahead.
So Brett, on the one dated back to 2020, the certified letter, was that also, would that have been also emailed and certified mail?
It was
Just like
certified
this?
mailed, it was emailed, and then it was published in the newspaper in our county.
Here's that one, the one for today, it states on there via certified mail and via email.
Right.
But the original one is not. It just says via certified mail.
That's right. And what we did on those December ones, though, we can provide that if you need it. Because we were only conducting virtual hearings. So we sent, because of statutory law, we had to send them certified, but we emailed everything to the respondents to try to interact to get them set up, and we heard no response.
Any further questions for either party?
Brett, I didn't have a question. So you did say you initially sent the first request via email also. And it's not listed here. Are we definitely certain that it did go through on our end of it? Not that she actually received it, but it didn't get caught up on our end.
When you meet due process, the law says it's got to be certified mail or proof of publication. So the email was really a courtesy in trying to contact the individual, because we were doing virtual hearings and we could correspond best that way.
But by law, that's not a necessary thing that we do.
That's right.
It's just something that we do for our nurses.
Right, and so that we could maintain having hearings. When we did virtual, we just started incorporating email so that we could do the Zoom, have the hearing, etc. But that's not a requirement.
Can I ask her a question?
Sure.
Ms. Hill, can you hear me?
I can.
And you did not receive any email from the Board of Nursing prior to notification of this hearing?
No, I did not.
And will you have the same email address that you've
I
always
do.
had here? Okay. I have a question. This is for Ms. May. When you email these notices, do you copy yourself or ask for a read report from the correspondent?
Typically, what we'll do is we email everybody in the legal division with a high importance. I don't know, I cannot remember if we did a read receipt or not on that, to be honest. I can tell you that everyone's emailed and it's of high importance.
So it's got the little red flag.
Right.
And you have access to a copy of that if it's needed?
Sure, if needed, but again, it's not.
It's a courtesy.
Right.
It's courtesy.
Right.
So just to be clear, Ms. May, the statutory requirement is to send it via certified mail.
That's correct.
Your sending of the email is merely courtesy.
That's right.
I'm sorry, y'all, I've got another question. Ms. Hill,
Yes.
when you left your Kosciuszko address, did you think about maybe putting a forwarding address? I know it was not good circumstances, but
I didn't at all
I'm
at that
sure, no, we're
time.
not the only ones that were trying to find you at that time.
Let me just. Ms. Hill, let her finish asking the question before you
Okay.
respond. The court reporter is trying to take down everything that's said. So we want to be able to have one person speaking at a time. Thank you.
So you did not go to the United States Postal Service and do a forwarding address or the usual when you leave address or move from one place to another?
I did not.
Yeah, but it's not restricted delivery.
So Ms. Hill, when you moved to the different address, how long were you at that address?
I stayed in Flora from probably, I would say October to February, it was during the ice storm actually, when I ended up having to just leave and be done with it because it was bad even there. Trying to get him sobered up with his family. And there was, he was physical again there. And I believe it was February the 17th when I left and then just came back to Louisville because it wasn't gonna work out.
Do you know how long after you change addresses that you're supposed to report that to the board?
I'm not sure on the time frame. Is that what you were asking me?
Yes, ma'am.
I'm not sure on that time frame.
Ms. May, can you share that with the board?
Sure, it's 30 days. That's in 2820. Can't exactly recall the exact provision, but I know it's in part 2820 of our code.
Ms. Hill, do you realize as a licensee of this board that you're supposed to be aware of the rules and regs?
Yes, I do.
You're also aware that you're supposed to comply with those rules and regs.
I do.
Is there anything further from the board panel? Ms. May, if you have a closing, you can make it at this time.
Closing.
Ms. Hill, if you have any closing remarks, you may make them at this time.
I do not.
All right, thank you. I guess at this time, we will entertain a motion for the board to enter closed determination to ascertain whether executive session is necessary for deliberation on this matter. It's been moved and properly seconded. All in favor, please signify by saying aye. Any opposed? The motion carries unanimously. Now entertain a motion for the board to exit to executive session for deliberation on the appeal regarding license number R892414, case number 2018-0041. It's been moved and properly seconded. All in favor, please signify by saying aye. Any opposed? Motion carries unanimously. Board panel will now exit to executive session for deliberation on this matter. Ms. Hill, we will return with a decision regarding this. Thank you.
Okay.
You're unmuted. I got you.
You do some rock. You do some rock over here. Yeah, I am. I got
What's wrong with the screen? Was flickering real bad. Oh, okay.
Maybe.
I'm sorry to bother you about that.
Come on.
Where's our?
Okay.
report?
I need to.
True mileage. Look at it.
I got, I will.
Thanks.
That's it.
I need to sign a different one.
Need them all. I fixed mine. Okay.
Hers is on.
Who's that? Sandra more. Huh?
Fix mine again.
Oh, let me look at it.
Thank you for your patience. We are back on the record. I'll entertain a motion for the board to return to regular session. It's been moved and properly seconded. All in favor, please signify by saying aye. Any opposed? The motion carries unanimously. The board panel is now back in regular session. Following deliberation on license number R892414, the board panel renders the following. The revocation is upheld. However, the board has decided to waive the application to apply for reinstatement that year time frame. So the appellant is eligible to apply for reinstatement immediately. Once that application is received, it will then be set for hearing. Are there any questions, Ms. Hill?
You said I'm eligible to reapply for reinstatement. Is that correct?
That's correct.
Okay. Do I just do that online?
Ms. Hill, we will send you a restoration packet that has all the information. That email address that you utilized to communicate with me, that's still a good email address, correct?
It is.
I will email you all of that information.
Okay.
Ms. Hill,
Yes,
please update your address.
I will.
Do you have anything further,
I think that's all.
council?
Nothing.
Thank you for your time today. That will conclude the board's business for today.
Thank you.
Mr. John.
Mr. President.
Yes, back in the record, I understand there's a gentleman on the line that tried to speak at the front of the meeting, but there was some difficulties with the being able to hear. Are you still there, sir?
Yes, I am.
It's here to help save time and money and trips to the pharmacy.
Go ahead with the question.
Okay. Yes, nursing professional organizations have recently come out with a strong statement in support of COVID vaccine mandates. And my question to the board is that if a hospital mandates vaccinations and licensed nurses refuse to participate and refuse vaccination, is that considered unprofessional conduct, or would that be eligible for review by the Board of Nursing as a violation of Nurse Practice Acts?
That would be a legal question that I would not be able to answer at this time. I can get with our counsel and discuss with them on what they would look at as far as that. And if
Jobs
you
in
can
the
get us
leisure
your
and
contact
hospitality group, as well as
information.
retail saw gains, along with office jobs and those.
Okay, I think I have the appropriate emails and, but I was asked to ask that, I was actually directed to ask that in the public forum. So I have, and I guess I'll go back to the private email and try to get that answered that way. Thank you.
Yeah, I know as a board, it's been discussed whether we should, come down as some type of regulation mandate. And we leave that up to each individual.
When you're looking at some of these numbers on leisure and hospitality, on retail, on public sector jobs.
Thank you.
Well, bottom line is, yes, we are improving, but we have slowed.
That is it. Entertain a motion to adjourn.
So moved.
Thank you. All in favor?